Hi everyone, this is Evita and Sean Duffy here at From Z to X, a new podcast from the Federalist.
It's new and it's great. It's great to be with you guys too. Merry Christmas.
So we're going to talk about AOC, of all people, having issues with socialized medicine. But first, we're going to talk about school closings and who is in school and who isn't.
So what are the stats? What's going on in America and how is remote learning impacting American kids?
Well, that's a great question, and I'm going to read to you a couple headlines to explain really what the situation is in the United States.
You read and I'll drink coffee.
So first we have coronavirus, failing grades spike in Bay Area schools with distance learning. Then 25% of Wake middle and high school students failed a class during remote learning. Remote learning increases failing grades by 83% in Fairfax County. And then finally, 5,000 Alabama students haven't shown up for any sort of class all year.
So 5,000 kids in Alabama haven't gone to school. That's 5,000 kids falling behind that don't have a shot at the American dream. Now, do you have stats as well on what's the differential of African-American kids that are remote learning versus white kids who are actually going to school?
Yeah, so 70% of Black kids are in remote learning, 60% of Hispanics, and only 40% of white kids.
So what does that mean for the opportunity that these kids are going to have when they get through school and become adults? What opportunity impacts does this divide have on those kids?
Well, we know that education is key to the American dream and success. And what's really interesting is Democrats who say that they want to bring equity and racial justice in the United States are actually creating this divide between the educational opportunities and success of Black versus white and Hispanic students.
Yeah, and what's hard to see is when kids are learning at home, and we've gone through this in our house, it becomes very challenging. So as kids are, if they have to do, read a book and do a book report, that's far easier at home. But if you're trying to learn math, it's easier to be in a classroom to learn math. If you're on videos then after to supplement that work, that's one thing. But learning math for the first time, it's easy to be in the room and be in front of the board and be able to ask questions to your teacher. And if you don't start learning math remotely, you start to lose confidence. And what happens in math is it builds on itself, right? We learn one thing and the next thing and it builds. If kids don't get the fundamentals in math, and they lose confidence and they're falling behind, it's really hard for those kids to catch back up. Yeah. And again, I think this has devastating impacts on the American future, and especially when our kids are at home learning, many of them, and in China, right? Yeah. 195 million Chinese kids aren't home remote learning. They're actually in school learning. What do the Chinese know in regard to science that Americans don't know about science, right? Maybe it's not science, maybe it's all politics, right? Maybe it has to do with the teachers' unions. What are teacher unions coming into play in this, Evita?
Yeah, so teachers' unions have been one of the main drivers of kids having to do remote learning, which we know has been totally unsuccessful. And this is something that was recently tweeted by the Chicago's teachers' unions.
Not political, I'm sure.
A push to reopen schools is rooted in sexism, racism, and misogyny.
Right, so that's
really politicized is what they've done.
That's insane, right?
Yeah.
Because all across the country, even in states that have significant shutdowns and lockdowns and restrictions, even in those states, we say there are essential workers, right? You have to be able to deliver food into communities and essential supplies like paper toweling or toilet paper and whatever. And those people can go to work. And so what the teachers unions in places like Chicago are saying is, we're not essential. Your kids learning from us aren't essential. And the problem with teachers unions, this is not all teachers, by the way, this is the union reps for these teachers, is they have huge political influence, especially in Democrat cities and Democrat towns, because they give so much money to the Democrat effort that when they say we want to stay locked down, the politicians actually listen to them. And we always say we're supposed to look at science. Democrats say they're the party of science. And the science will tell us that kids basically have limited impact from the virus on them, right? I mean, so they're dying at very low rates. Many of them don't get sick at all, right? And here we're keeping them at home. I mean, this just doesn't make any sense, does it?
No, it doesn't. And I think that when we're talking about this gap that's being created, I think that you brought up a good point about frontline workers. People who are working, who have kids, they can't sit at their computer all day and help their kids with math homework, like you said. I mean, they have jobs, and so parents who maybe can have one person who's at home, or maybe both of their parents are working from home, can actually sit by and make sure that the computer's on, or they can put their microphone on. I mean, these are little kids. They don't know how. I mean, like you're
Right.
There's one age where you're like, okay, they can handle it. But when they get into younger ages where it's super formative, that they need to be learning and but the problem is that they can't even get onto the class themselves because they don't even know how to work their computers, and they don't have parents who are sitting next to them doing that. So people who are working class are actually, their children are very disproportionately harmed by this remote learning system that we're in.
Yeah. So if you have two parents that are going to school, going to work every day, but your kids can't go to school and they're staying at home, the problem with that is one of the parents are going to have to give up their job to actually do remote learning with their child, especially if you have kids that are in elementary school. So it's having a huge impact on the family also.
But let's go back to China for a second.
Yeah.
Because in China, we know that, education-wise, they consistently outperform us in international tests. There's a really famous one every 3 years. They take it, and every 3 years, not only does China outperform the United States in math, science, and reading, but they actually outperform themselves. So, and we remain pretty stagnant in our test scores. So basically, they keep doing better, and the gap between them and us is only getting bigger.
Yeah, listen, and so education is key to innovation and creativity. And if we're falling behind in math and science, it has impacts on the American future and the I'm not going to say conflict, but the butting of heads between the U.S. and China. The U.S. wants to be the global superpower. Right now we are. And we're a country that believes in freedom and democracy. China does not. They're communists, right? Mm-hmm. That's the vision they have for America under their rule. And we have this democratic idea, very different philosophies, and I mean, very important for what happens globally in the coming years if we keep falling behind. And so the bottom line is, get our kids to school. This makes sense. Open them up. Your sisters and brothers in our community would, if they went to public school, they would be learning from home. We send our kids to a Catholic school, and at the Catholic school, they wear masks, they social distance, but they're actually going to school. And we think the rules are a little bit excessive. However, we're willing to abide by those rules because we're happy that our kids get to go to school and learn in person. And really, there's been no outbreak. Yeah. They're very sensitive. If someone in one class has exposure, everyone in that class quarantines for 2 weeks. And so we're doing it. Private schools, Catholic schools are successfully educating children. The question becomes, why aren't public schools doing the same thing? And it's sad because our kids are having a huge personal impact. Your sister, our first grader, had to be at home for 2 weeks because someone in the class was exposed to COVID.
Yeah.
And then she went back to school for about 5 days, and then she was exposed. Our daughter was exposed to COVID. And then she had to stay home for 2 weeks after. And so she was home for a month. And in essence, she said, I'm missing the best years of my life.
Yeah, she said that it
horrible.
was so cute.
They want to be in school. They want to see their friends. And I don't think we're yet understanding the social impact on young people that these shutdowns have had. And again, if this made sense scientifically, great. But right now it doesn't. By the way, can I just make? I'm talking one last point. If you have if you're a child that lives with someone with comorbidities or someone who's really old, well, it might make sense for you to keep that child at home and do remote learning because you don't want to expose potentially those family members who have a high propensity, if they get COVID, to have serious complications. Mm-hmm. But that's not everybody. A lot of these kids can be going to school. And again, the choice should be the families whether to keep the child at home, but we should err on the default position of opening schools up.
Yeah. Well, and I think that, there's been tons of stats that show even before COVID that kids who fall behind in public schools have a really, really tough time getting back on track. It actually is detrimental to their education usually, and their success. And I think that as someone who's on social media, I'm young, I see it all the time. Kids.
I'm old, I'm not.
You see on TikToks and on Instagram and elsewhere, people are like literally admitting that they aren't learning that much in online school. Talking about cheating, talking about me when I'm a doctor and in 15 years having gone to online school, and it's them like failing a surgery. Like they admit it themselves that it's not working. Yeah.
So again, I think this is a tragedy in America right now, and it makes sense to do this differently. And shame on the leaders of states and cities who have their schools, shut down for. Again, it started in late March, early April last year, and still going through today. Open them back up. Enough of the politics. Let's actually follow the science, which says kids stay safe with regard to COVID. Right?
Yeah. Right. So now we're gonna move on to our favorite Hispanic Democratic leader, AOC. So she
favorite, really? Okay.
Fake favorite. Okay. Fake favorite. So she recently tweeted this. I'm gonna read it. Republicans like to make fun of the fact I used to be a waitress, but we all know if they ever had to do a double, they'd be the ones found crying in the walk-in fridge halfway through their first shift because someone yelled at them for bringing a seltzer when they wanted sparkling.
Okay, AOC. First of all, what do you think about AOC claiming that really only progressive Democrats are the ones who work hard, right? The ones that, take the tough jobs in America. And in a later tweet, she basically said Republicans sit back in their leather armchairs, right? This is her view of the parties. What's your take on AOC's tweets?
Well, first of all, it's ludicrous that only she is the one who's had a hard job in their lives. I think everybody has experienced having their starter jobs, and it's not very fun, and it's minimum wage, and that's the American dream. And actually, her tweet is a perfect example of the American dream. She was a bartender, and now she's a U.S. representative, and that doesn't happen in other countries. But it happens here in the United States. And I think it was a year ago, she said, the American dream, it doesn't exist. Lifting yourself up by your bootstraps is a ridiculous phrase. And yet she did it herself. And this tweet was proof of it.
Yeah, and what we understand is that hard work begets success, right? If you have a little bit of God-given talent and you work hard, you can become successful in America and you can live your dream, whatever that dream may be. And Republicans, group of hardworking folks, actually have done that. And what's fascinating about AOC is, she's missed the memo that you have these globalists and these billionaires and these elites on the coast who do very, very well, who are Democrats, socialists, communists like her. But the working men and women of America, and this has been a recent transformation here, they've loved Donald Trump. They've loved Republicans who are fighting for their jobs and their opportunity and their wages. And talking about waitresses, if you're a waitress, you're not with AOC because AOC wants you to lose your job. You have no income, you have no tips, right? But if you're a Republican, you're like, open up, at least do it smartly. Let's do it outside. Let's have 20, 50% capacity, but Republicans want to put waitresses back to work, and AOC wants to keep them at home. So give me a break, AOC. What a joke. She's missed the memo. Hard-working Americans love Republicans, elitists, globalists, billionaires, all Democrats. Right. Most of them, not all of them.
So a little subplot to her tweet was when she admitted how she had really crappy health insurance when she was in New York.
Wow.
So why don't we talk a little bit about New York and health insurance? I was going to ask you why would her health insurance be so bad in New York City?
Right. So New York, the precursor to Obamacare, had this great idea that what we should do is make sure, again, and not all of these concepts are bad, but implementation is key. What we want to do is make sure everyone has access to health care, and we don't want to discriminate in regard to prices. So if you're 20 years old, if you're Evita, you're 21 and you're healthy, you have no complications, versus someone who's 60 years old who has, maybe you have cancer or COPD or some other ailments, right? We want to say that Evita and the 60-year-old should pay the same amount. We shouldn't discriminate against them. Well, then the net cause of that was prices skyrocketed, right? Number one. And then if you're 20, you're like, well, listen, this doesn't make sense to me. I'm not going to buy insurance, right? So the healthy people dropped out, and then health insurance became even more expensive for the sick people, right? Because they couldn't offload that price on young people because they've left. And the healthcare system in New York became a death spiral. Then Obamacare comes into effect, and they implement similar concepts, but not as bad as New York. But the bottom line, we want to make sure people can access health coverage if they have a pre-existing condition. Yeah. That's smart. But if we offload the cost of subsidizing that premium on young people, it drives up the cost of the premium, number one. And then number two, if we mandate that everyone has to have all of these coverages in their health insurance plan, that also drives up the cost of healthcare. And you might think that's great, right? We want to make sure you have, all the coverage under the sun and the stars and the moon and whatever the analogy is. But if you can't afford it, right, because it's really expensive, that doesn't matter. Yeah. And by the way, AOC in New York saw that she was priced out of health coverage while she was a bartender in New York, and then saw how she was priced out of coverage when Obamacare was implemented in 2014. So really hypocritical that AOC, who has supported socialized medicine, has understood that the cost of socialized medicine goes up dramatically from a market-based system.
Yeah, no, I agree, and thanks for explaining all of that. So essentially, the premiums go up, and then no one can buy into this system. And I think it's extremely ironic that she's going to, be advocating for socialism in general in America, but also socialized medicine, and she herself didn't even like the system she was in. It's really incredible.
Right. So and so now, because Democrats have broken health. So healthcare was broken. Democrats really broke it with Obamacare. So now the answer is, let's just have a government-run system where government pays for all your insurance. Here's the problem with that. It's not addressing the root cause of the increase in prices for healthcare. All it's changing is who pays for healthcare, right? So the costs still go up, but we're going to pay healthcare premiums through our tax dollars. And if we're going to fix health delivery in America, we can't just change who pays for it. We actually got to address what's going on with the rising costs of healthcare in our country. And so Democrats are way off base here. And this is just one way to socialize another part of our economy, but it really won't address the root increases in price increases.
And so, what do you think that the future is for healthcare in America? I mean, I've been thinking about what is Congress going to do? Has there been any proposals? Do you know what's happening?
So right now the sides are so far apart that you're not going to see Democrats who want to socialize medicine and Republicans, who want a more free enterprise system. And let me just tell you, maybe talk for a second, but I do have an idea of what they could do. So Republicans want a more market-based system, right? Yeah. When we keep creating rules in government to try to fix the rules that messed up healthcare from government, what's the little kid story about the old lady who swallowed a fly and then swallowed whatever to kill the fly, and then
you know the story.
Whatever the story is, I'm sorry, but let's let the market innovate and create in healthcare coverage and in healthcare delivery. And if we do that, I think we're going to see in every space that markets actually work, prices come down, and delivery is better, products are better. So a more market-based system, I think, would help that out. But Democrats and Republicans won't agree. So here's the answer. What we have to do is say we are going to take off all of the restrictions, and we are going to give these decisions back to states. The federal government is going to give those states their money back, right? They're going to be able to make plans that work for their states. And so if you're in California or in New York, the federal government's going to allow you to create your own plans in those states, and we're going to give you your money back. And if you want to be a socialist system where you have single payer, everyone gets health care, great. But if you're in Texas or you're in North Dakota and you want to have a free enterprise system, you can do that too there. And then if we go out 10 years from now, we can say what system worked. And I'll come back on the podcast and say if socialized medicine gives better health care at better prices, I'll admit I was wrong. I don't think I'm gonna have to come back and do that, because we're gonna see that as these 50 states have way different healthcare plans, it's a laboratory. We're gonna see which ones actually work. Yeah. And I think you're gonna see free enterprise systems give better healthcare and better prices. And again, this is an experiment. Let's not just slam down policies on the American people with something that's very important to us, which is healthcare, when we don't know it's going to work. Let's let our states decide for themselves. That, I think, is the only way you're going to get Republicans and Democrats to agree, and then give states the freedom to make plans that work for them. Am I crazy on that?
I mean, I guess we'll find out, but I don't think so. But I think that's a great example of what we can do. It's let everybody else decide. It'll be like a little test.
Couldn't freedom work, right?
We'll see what everybody else did. Yeah.
And I mean, again, so just one last point. We got to go in a second, but we're very removed from our federal government. It's hard to move. Even as a congressman, it was hard to move the federal government. Just a person in a state trying to reach out to their senator or their congressman, it's really hard. You have far more opportunity to move your state government and have an impact on what kind of health care you get with what kind of health care plans. That's the way to do it. And that's the only way you're going to get an agreement right now in regard to this really important system. But freedom always works. Markets always work. Let's go back to that. Get government out of the way.
Thanks for your insights.
I'm just sorry. I had too much coffee, I guess, this morning. I'm riffing too hard on C to X.
All right. See you guys next time.
Have a good one. Merry Christmas.